My name is NOOR HASSANAH binti FADZIL. I am 1171047. I am from PAB 4. My titles for my proposal is Exploration on Adjustment Experience of Person Under Surveillance (PUS) during quarantine period in the quarantine center. Okay, so this presentation for my subject, Research Method in Counseling, ABA 3233. Okay, so there are 3 chapters in this presentation. Chapter 1 is involve research background, problem statement, research questions, research objective, significance of study, scope of study, definition of terms. And the second chapter involve counseling theory and research based on Islamic perspective. And the last chapter involve research design, population and sampling, data collection and procedure, data analysis, and lastly, instrumentation. Okay, the first one for research background. According to NOOR, there are many cases of this infectious disease around the world, starting from the first case in Wuhan, China, and it was rapidly infected to others in a short period. The latest of 20 April 2020, the total number of confirmed COVID-19 cases had reached more than 88,000 in China. So previous studies of similar viral respiratory diseases such as severe acute respiratory syndrome (SARS) have shown that the infected patients present with varying degree of mental health problems even after being discharged from hospital, indicating that the mental status of these individuals should not be ignored. So the quarantine is one of the effective ways in protecting or restoring public health. The impact of quarantine to oneself depends on how they will adjust themselves during and after the quarantine process. The presence of a chronic illness alters an individual's sense of self, as the previously held healthy identity is replaced by an illness identity that includes physical impairments, emotional reactions to physical symptoms, and cognitive construction of the illness. Okay, we move to problem statement. This process is often unpleasant experience for people who undergo it. Separation from loved one, field of board, and daily activities become limited. The following condition will occur over a long period of time and will have various effects on quarantine people or person under surveillance. And according to NOOR, previous studies stated that survivors of viral infectious disease are disposed to depression, anxiety, adjustment disorder, acute stress-related disorder, and post-traumatic disorder. So these results show that quarantine people have bad effect in terms of their mental health during and after quarantine process if they cannot adjust themselves during that time. Okay, there are 2 research questions in my study. The first one is, what were the experiences faced by the person under surveillance undergoing a quarantine procedure at the quarantine center? Secondly, how does the adjustment experiences affect toward person under surveillance mentally, emotionally, and physically? So, and there are 2 research objectives in my study. The first one is to explore the experiences of person under surveillance undergoing a quarantine procedure in the quarantine center. The second one, to identify the impact of adjustment experience towards person under surveillance mentally, emotionally, and physically. Okay, for significance of study, there are 3 parties. The first one, my study was helpful, who seemed to develop well-informed about the current experiences might faced by the students university during quarantine process. The second one, my study will help society to cope issues regarding to the adjustment experiences into new situations, especially when they are facing chronic health or events. And the last one, my study will help Ministry of Health Malaysia to develop ways or initiative in helping person under surveillance to cope their adjustment experience. For scope of study, I will use to interview So in the interview will be conducted towards 5 people who have the experiences with quarantine process at any quarantine center. Okay, so this method to look in depth about the experiences, their interpretations, and their copy method toward the challenges. Okay, we move to the definition of terms. There are five terms. The first one is adjustment. According to Sharma, adjustment is a process which reflects total personality of a person by balancing and equilibrating his behavior according to the present condition, or we can also say that adjustment is a process maintaining, adjusting, and behaving according to physical and social environment. And for the surveillance, according to Langmuir 1963 and Henderson 2016, surveillance is a continued watchfulness over the distribution and trends of incidents through the systematic collection, consolidation, and evaluation of morbidity and mortality reports and other relevant data, together with dissemination to those who need to know. The third one is person under surveillance. According to NATMA Malaysia, individuals who are subjected to quarantine orders and holding a letter of orders for supervision and observation at home for contact of 2019 novel coronavirus infection under Section 15, Prevention and Control of Infectious Disease Act 1988 under Act 342 is called as person under surveillance. Okay, and then quarantine. According to the Central Language, Smith and Friedman, quarantine is a movement restriction of persons who are presumed to have been exposed to a contagious disease but are not ill, either because they did not become infected or because they are still in the incubation period. And the last one, quarantine center. According to NATMA Malaysia, a quarantine center is a place of isolation and health observation which has been gazetted under the Disease Prevention and Control Act Infectious 1988 under Act 342, including hotels or any other premise determined by the government. Okay, we move to the next chapter. For the counseling theory, I have two theory, includes RABT and cognitive adaptation theory. For RABT, this theory was developed by Albert Ellis in the 1955. So this theory purpose to identify the negative thought patterns that may lead to emotional or behavioral issues faced by quarantine respondents. And this theory also helpful for people living with variety of issues, including depression, anxiety, phobias, aggression, and sleep problems that related to participants' issue during or after quarantine period. And this theory also related to the event that may encourage them into irrational belief and lead to emotional and their behavior during quarantine process. Okay, our next theory is cognitive adaptation theory. Okay, so this theory is one resilience framework that has been used to study disease adjustment. So the traumatic events such as the onset of a chronic illness threaten one's assumptions about the self and the world, and successful adjustment require the restoration of these assumptions. And as an evidence, Janoff Goldman 1989 said those who have faced trauma or chronic disease view the world somewhat differently than those who have not. Okay, for research-based Islamic perspective, from Surah Al-Isra verse 15, the translation, whoever is guided is only guided for the benefit of his soul, and whoever errs only errs against it, and no bearer of burdens will bear the burden of another, and never would we punish until we send a messenger. Allah has explained and reminded his servant, which is firstly to save himself in accordance with the guidance that has been shown by Allah, while the second to remind his servant that someone who has done and chooses the wrong path will cause loss in himself. So this ayat was related to the process of self-adjustment, that people makes, that wherever he is required to adjust where he is so that the individual is able to gain peace in the future. Okay, we move to the next chapter. For research design, I used qualitative study to conduct my research, and which is use phenomenological method. So I use interview approach to collect the data from the participants, and telephonic interview will be conducted due to the current condition. And the purpose of using this qualitative method due is to my curiosity to understand more about the participants' experiences, interpretation, especially under surveillance during quarantine period. Okay, for the population and sampling, I choose simple random sample and select people from have experiences with quarantine process at any center in this country, Malaysia, and the participant is about 5% who have undergone the quarantine process. And we move to the data collection and procedure. I will begin by appropriately assembling the participants, determine and choose a number of participants, and I will choose topic related to the study, and then I will provide informed consent as an agreement from them to proceed the interview. So before the interview conducted, I will inform the purpose and the duration of the interview. I will rely on open-ended questions during the interview. I will build a good rapport and ask easy question first, then move towards the complex one. So the interview sessions will be recorded with digital recorder with participants' permissions. Okay, for the data analysis, there are six steps. The first one, organize the data, explore the data through coding, build overarching themes in the data, represent and report the finding, interpret the finding, validate the accuracy of the findings. Okay, for the instrumentation, I will use interview as my instrument in this study. So the interview will be conducted with 5 participants from those who have experiences with quarantine process at any quarantine center. So before the interview will be conducted, I will form an interview protocol first that was aligned to the research questions in this study. So the themes of the interview question are about the self-endurance in the quarantine period, self-management during quarantine, adjustment experience of a patient during quarantine, the challenges during quarantine, and the lesson from quarantine process. So my interview will provide 7 questions in the interview session that will be conducted in structured team. There is same of interview questions provided to each of respondent, and the questions are already planned and also created in advance. So that's all for my presentation. I hope you guys will understand and clear with the explanation. So thank you.